Hi everyone, if you are preparing for NCLEX and you feel like the questions are confusing or tricky, this video is for you. Rule number 1, safety always comes first. Look at this question. In this question, the correct answer is apply a bed alarm. Why? Because this patient is immediate risk of falling. Reorienting can come later. Medication are not the first step and calling the doctor doesn't protect the patient right now. So remember, NCLEX loves safety. Now, rule number 2, assess before you act. Here's the question, and the answer is assess oxygen saturation first. Why not give oxygen immediately? Because the patient is not crashing yet, and NCLEX wants you to collect data first. So, unless the patient is actively dying, assessment comes before any intervention. Any intervention first to assessment. Rule number 3 is the famous ABC rule, airway, breathing, circulation. Look at this question. The patient with oxygen saturation of 88% comes first. This is the answer. Pain, fever, anxiety, none of those matter more than a breathing. If the patient can't breathe, nothing else matter. Always think, is the patient airway open? Is the patient breathing? Rule number 4, acute is more dangerous than chronic. Acute always beats chronic. Always remember this. In this question, patient with a new onset chest pain is more dangerous than someone with a long-term hypertension or a controlled diabetes. NCLEX wants you to focus on sudden changes. If it's a new, unexpected, or a rapidly worsening, it's urgent. You have to focus on that question answer. Rule number 5, actual problem over a risk. Actual problems come before risk problems. Active bleeding always comes before risk of bleeding, risk for bleeding. Why? Because something is happening right now. We have to focus on the sudden things. NCLEX prioritize what is real, not what might happen. Rule number 6, least invasive first. Least invasive intervention always first. A patient is having a difficulty breathing. Do we intubate? Give IV drugs? No. We reposition the patient and give oxygen. NCLEX wants you to start with the simplest, safest option before moving to aggressive treatments. Always remember this. Rule number 7, unstable patients always come first. A blood pressure of 80 over 50 is dangerous. Discharge teaching, mild headache, or a stable post operative patient can wait. If vitals are abnormal or the patient looks unstable, that's your priority. You have to choose that patient without thinking about others. Rule number 8, don't aid, remove, or teach anything. If patient becomes dizzy after an antihypertensive medication, the correct answer is to hold the medication. Always hold. NCLEX usually prefers holding, stopping, or educating the patient rather than adding more drugs. So think, can I remove the cause instead of adding something new? And ask doctor before adding. Rule number 9, nurses do not diagnose. Nurses not diagnose. If patient reports chest tightness, the nurse does not say this is a heart attack. The correct action is to assess the patient pain characteristics. We assess, monitor, and report. Diagnosis and prescribing belong to the doctors only. Now, rule number 10. When in doubt, choose the safest answer always. And finally, rule number 10 is that when you are stuck, choose the safest answer. A confused patient keeps removing IV lines. Applying restraint is never the first choice. We always keep restraint last. Requesting family presence is safer, less restrictive, and protect the patient. NCLEX always prefer the least restrictive and safest option. And if you want to understand these rules more deeply, go to this channel and watch this 7 video. It will definitely help you. If this video helped you to understand how to think for NCLEX, save it and share it with your study partner. Subscribe to this channel for daily NCLEX question and explain simply, and comment below which rule you struggle with the most.